Hey everyone, it's Dr. Tam here on another webinar, and today's webinar is going to be special because I'm going to show you how the rest of the world tackles back pain. Are you ready? You're going to be visiting all 7 continents with me. I really hope you are ready. So hang on to the seat to make sure you don't fall off as we travel across the world. Here we go. So here's an introduction. Today's webinar, we're going to take you across the world, diverse cultures and approaches to how they take care of back pain, right? Because ultimately, we need to take great care of ourselves. Our backs is one of the most important areas in the body. And quite frankly, it's the area of the body that really attacks us the most. It's the most prevalent problem among musculoskeletal problems. It costs people billions of dollars every single year due to lost work and lost production. So it is absolutely necessary. But the key thing is, I want to show you how the rest of the world is doing it, not just us here in the US. All right. So let's dive in. Who am I? My name is Dr. Alex Tam, and I have a Bachelor of Science in Exercise Biology from UC Davis. I've been a clinical director at Absolute Integrative Physical Medicine since 2009. So today it's going to be 15 years in a few weeks. We've treated over 10,000 patients in our office from the surrounding area, patients traveling as far as through multiple states to get into our office, crossing oceans and all. So different continents as well. We've treated people from different continents. So it only makes sense if I share with you what other continents are actually doing. And then at the end, we'll show you how we do it as well. So our mission in the office is to help patients with chronic pain get their life back without the use of harmful drugs and unnecessary surgery. If that resonates with you, this webinar and future webinars are going to be for you. So here's a disclaimer. The information provided, I have to read this, okay? The information provided in this webinar, including methods, treatments, and concepts, is solely for educational purposes and is not intended for medical advice. While we aim to present accurate information, we do not guarantee that the approaches discussed here are effective for everyone. Before starting any new treatment, please consult a qualified healthcare provider. The views expressed here do not necessarily reflect the official stance of Absolute Integrative Physical Medicine, which is not liable for any decisions made based on this webinar content, including myself. This presentation is not a substitute for professional medical advice. Thank you for joining us, and we hope you will find this webinar both informative and enlightening. Here we go. So, some fast facts about back pain. The prevalence of back pain. I told you it's one of the most, it attacks more people in the musculoskeletal space than any other problem. Well, this is one of the most reasons why people go to the doctor's office. Approximately 80%, 210 million people in the US experience back pain in one form or another at some point in their life. It is also the leading cause of work-related disabilities worldwide. It costs the world $100 to $200 billion. Wait, this is just the US every year to the treatment of back pain. Now, back pain can be caused by a variety of factors, including physical strain, aging, degenerative diseases like arthritis, poor posture, obesity, and psychological stress. Can you think yourself into having back pain? Yeah, that's what that one means. Mechanical issues, soft tissue injuries are also most common causes. Treatment and management, while severe cases may require surgical intervention, the majority of back pain cases are treated with non-surgical methods such as physical therapy, some medication, chiropractic adjustments, acupuncture, and a lot of other treatments that I'm going to be talking about in here. Regular exercise and maintaining a healthy weight can also help prevent back pain as well. I mean, I've seen patients get surgery or offer surgery where they are nowhere near the needing of surgery. So even if they did, you got to go through some more conventional ways of taking care of your back first. So let's dive in. 7 continents. We're going to visit Europe, Africa, Asia, Australia, Antarctica, South America, and North America. We're going to show you some of the most popular methods that they use to treat back pain. So here we go. Let's start in Europe. Beautiful, doesn't it? Doesn't it look great? Doesn't it look like every time, every picture that we've put together here makes me want to go there and visit. Hope it does the same for you as well. Now, a Swedish massage. The Swedish massage was developed by Johann Georg, okay, or Georg, in the 19th century, which in the 1800s, all right, Johann Georg Metzger become one of the most popular massage techniques globally now, Swedish massage, okay? And it is often mistakenly attributed to Swedish gymnast Per Henry Ling, but it was also Metzger who systematized the strokes techniques for what is known as the Swedish massage right now. It helps with muscle relaxation, absolutely with circulation, release endorphins, and increase in flexibility as it breaks down some of the scar tissues in the body, but also get more blood flow in that area. That's what a Swedish massage is. So what's next? How about osteopathy? Osteopathy is well known in Europe for treating back problems. Okay, it is talking about the structure and function of manipulating and strengthening the musculoskeletal system. So Europe, they know. Okay, people in the European countries know how to take good care of their bodies. And they're looking at the bones, they're looking at the structure, they're looking at stretching, right? They're looking at gentle pressure, resistance. And it shows that, hey, improving mobility, reducing pain, blood flow, overall well-being. Notice a couple differences, but similarities as well. Stiffness, blood circulation. This is the second time we talked about blood circulation now. Probably won't be the last. Now, regenerative medicine. Back in 1938, the book of Culture of New Organs was published by Alexis Carrel and Charles Lindbergh. Okay, and they talked about regenerative medicine in there, where they developed an artificial perfusion pump that facilitated organ perfusion outside the body during surgery. Right. So regenerative medicine was really started in Europe. As a matter of fact, there were a lot of athletes early on that went over to Europe to have regenerative medicine procedures on their bodies. Before the U.S. started offering it here in the U.S. So now, shockwave therapy, that was also our European friends, the Germans. Okay, back in the 1980s, lithotripsy was developed to break down kidney stones. Now, yes, lithotripsy is still used today, but now shockwave therapy started being used by other doctors around the world. Also, one of the best machines was also invented initially in Germany and Austria and Switzerland. Some of these major player companies, they started first. They started with the technology, continue with it. They started using it on soccer players, gymnasts, other athletes in Europe before we brought it over here to the US. So now we do it in our office, right? So now cold laser therapy was invented by a Hungarian physician, Andre Mester, in the 1960s, mind you, 1960s. Photomodulation, he saw the importance of light therapy and how it can excite cells, increase healing, increase the healing potential of the body, but also increases blood flow, circulations, and pain reduction, okay? This is called photobiomodulation, all right? I'll read it to you. Cold laser therapy utilizes LEDs to stimulate cellular function, enhancing healing, reducing inflammation without thermal damage to the tissues. A lot of the lasers nowadays, not only does it have the red light, but it also has the infrared light built in with it as well. Something food for thought. Now, let's move on a little south into Africa. All right. So in Africa, there are a lot of herbal medicine. People here in the US think that, oh, when they think herbal medicine, they always think of Asia, but in Africa, it has been used as well. All right, in the forms of roots, bulbs, tubers, bark, leaves, and flowers. Things that you find in nature, right? Have you never heard this before? Let thy nature heal the body. Well, there's a vast history in Africa, and they've been using it for quite a while. For back pain, herbalists may prepare Garcinia cola seeds, commonly known as bitter cola, all right, to ease pain and inflammation as well. Another word that's been popping up, inflammation. Heat therapy. They've been using heat therapy. I mean, it's when we think of Africa, we just think that it's hot, right? But even while it's hot, they're still using hot stones and warm sand heated by the sun, right? To promote, what is it? Increase blood flow, decrease stiffness. And when you increase blood flow, generally speaking, you're going to have less pain, which leads to pain relief. Okay. Now, chiropractic, formerly known as bone setting, the Egyptians did not call it chiropractic care. It was really called bone setting. The earliest bone setters were actually written in Egypt in 1552. Think about that. It's about to be, almost 500 years old is bone setting. And, D.D. Palmer in 1895 just took it to another level, put science behind it. So there's the science, the art, right? And you got the physical behind it. And now you got I should reword this. You have the art, you have the science, you have the philosophy behind it, and total combined, you make up chiropractic. The first initial bone setters was not here in the US, were not chiropractors. They were Egyptians. Okay. So take a look at that as well. A lot of history here. Let's now move on to Asia. How many of you recognize these two at one point? Wonders of the world. May still be. I mean, they changed the wonders of the world. Did you know that you can vote on the wonders of the world on a regular basis? People come together, right? World leaders, and vote what is the wonder of the world. And both of these, the Great Wall of China and the Taj Mahal of India, were at one point, maybe still currently, wonders of the world. So acupuncture. Acupuncture absolutely started off in China to stimulate what is called the meridian pressure points, right? Also known as qi in Chinese medicine. Now, it stimulates the nervous system. It helps by releasing neurotransmitters, trigger electromagnetic impulses, increasing blood flow as well. And that's acupuncture. Was started here in China. Well, it was started there in China. Now, Hilot or Hilut, depending on how you pronounce it, was started in the Philippines, where folk healers, right, look at a form of massage and stretch. If you start looking at Hilut massage techniques, you're going to start seeing that not only are there people practicing in the Philippines, but this type of massage has, just like the Swedish massage, has been brought to the rest of the world as well. Next time you call your masseuse or you call a new massage place, find out if they offer the Hilut method as well. Let's move on to Australia. Now, Australia, you recognize this cute pet over here? Well, maybe not a pet, a wild animal called a koala, right? And koalas are actually pretty vicious. You see their claws that they can claw on. They might not be fast, but they could probably hurt you a little bit. But let's dive into Australia, where they have tea tree oil. So many treatments in the natural realms of Australia uses tea tree oil. It will help with infections, muscle pains, cuts, burns. That's what they're stating. But also, a few things, anti-inflammatory. There goes that word again, inflammation, analgesic effects for pain relief, muscle relaxation, antimicrobacterial, antimicrobial. It should be that. I think that word. Antimicrobacterial? Well, antimicrobial to prevent infections as well. Now, a lot of the tea tree oil comes very in a very potent format. So a lot of times they have to be diluted with other oils as well. Now, medication. We've got to talk about that. Did you guys know that in New Zealand and here in the US, at one point, we're the only two countries that allowed medication commercials, right? Australia is one of the places in the world where 85% of people have experienced some form of back pain, right? In the US is 80, over there it's 85. So a lot of people also know that taking medications comes with different side effects, and people know it's not good for them, right? So they're always looking at other ways to enhance the body, from exercise to physiotherapy, pain management programs, controlling weight, having a healthy diet, lowering stress and anxiety. That's what they really focus on over there. Not too different from what we focus on. Now, here's our cute friend over here, okay? And I got to talk about Antarctica. You're like, well, who's there in Antarctica? A lot of scientists, and nowadays a lot of tourists as well, are going to Antarctica. But Antarctica is quite limited, right? Because there's not too many doctors on site, and a lot of people have to look at the rest of the world for self-care and prevention. They look at over-the-counter medications. They have to stay hydrated. When it's cold, it's ripping the water out of your body when it's cold that way, right? And everything stiffens up. It takes a little harder to do everything. And before you go to Antarctica, some places actually requires that you take a test to see how your body is doing before you actually go to Antarctica. So, food for thought. If you're not, your body's not as healthy as it should, you probably don't want to book your Antarctica trip too soon. Get your body right first, because if you're going out there into more treacherous terrain, you want your body to be functioning at a high level. South America, right? And in South America, lots of herbal medicine. Cat's claw, devil's claw, arnica, eucalyptus, aloe vera, coca leaf, chamomile, and mint. A lot of it comes from South America, right? Just like people in Africa, in Asia, in South America, they use a lot of medicinal herbal medicine as well, all natural. Clay therapy also was something that was found in a lot of cultures in South America. It involves putting natural clay on your body that promotes natural healing and wellness. Great for the skin. It helps detoxify musculoskeletal pain as well. A lot of spas actually offer clay therapy. Something to think about. Once again, it has anti-inflammatory properties, okay, because of the rich minerals can reduce inflammation, swelling, toxin absorption, and also heat retention. When you put heat on there, you put clay over it, packs in that heat, get that circulation in there. Inflammation, circulation, you're seeing that now. North America, right? You got the beautiful skylines, you got Banff on the right. Amazing. Now, here in America, we're not too shabby. Yes, we might have taken a few books and lines from other places around the world, but there are a lot of people, just like South America, using lavender oil, willow bark, rosemary essential oil as well. So a lot of herbalists and also holistic practitioners think that herbal medicine and oils are great for you as well. Now, here you got to learn a few things about what people are doing for their backs. And at our office, we really combine everything, right? A little bit of everything from the rest of the world. Chiropractic care really started, and there's a lot of chiropractors in the U.S. because it really started out here, 1895, Davenport, Iowa. The school still exists. You got the Palmer College over in Davenport, Iowa. I've been there myself. Cool, neat little town. where you focus on the spinal manipulation of the spine, adjustment. It's a holistic approach, non-invasive, and huge preventative benefits for your health if done correctly over a period of time. Spinal decompression, now this opens up the spine, takes away the pressure of the disc. Spinal decompression actually started in Canada, and then it was brought here to the United States in the 90s. If you look at the history of spinal decompression, it took quite a bit, legal things, because there are certain programs in the US did not want spinal decompression because there could be less surgeries in the long run. So it took some doctors blood, sweat, and tears to try to get this machine here and the technology here into the US. Just like what we talked about, we use shockwave therapy, bringing you from some of the technology from Germany, right? Laser therapy from one of the scientists and doctors from Hungary as well, and regenerative medicine. So overall, we want to make sure here you're getting European, right? You're getting some African history of the technology here from all the bone setters. And overall, I really, really hope that this webinar exposes you to more than medication, right? Because the ultimate goal for me is to show people what's our mission. Our mission is to help people with chronic pain get their life back without harmful medications and unnecessary surgeries. So ultimately, what I try to do every single month is to give you information where it can just make you think a little bit more about how you can better your life in the long run. So until next time, join me on the next webinar. Have a great day, and hopefully you maybe get to visit some of the places that we saw on here. See you guys next time.